Hi, my name's Trenton Romero,
My name is Ruby Lee.
My name is Manuel Garcia.
and we are Group 1, and we're presenting on the topic of morphine. So to get an understanding of morphine, morphine is a medication that's used in the medical field to treat moderate severe pain that typically can be ranging from acute to chronic pain. In the healthcare industry, morphine comes in two forms. It can be in a tablet that is used for oral consumption, or it can even be in a liquid for IV injections, which give it a more direct pathway and a more effective use in relieving pain. Because morphine is a painkiller, it is classified under the category of narcotics analgesics. And for patients in the medical industry, it is one of the last resorts of pain medicine because it is a very highly addictive drug. So understanding pain and how morphine became known as the pain drug, it was originally discovered by Friedrich Wilhelm Adam Saturner in 1804. At the time, this individual was a 21-year-old scientist that was an assistant to a pharmacist working with the opium poppy. And of course, with the curiosity of a scientist, he had managed to successfully isolate an alkaloid compound in the resinous secretion of the opium poppy. And from there, he had discovered that it was morphine that he had managed to successfully isolate. And in 1806, Friedrich would publish his research on this alkaloid compound, noting that it is significantly stronger to any other painkiller during the time, especially opium. And from his research, he would dub morphine after the Greek god Morpheus, the Greek god of dreams. And this was because he had observed the weariness and drowsiness effect that it had on people that he tested it on.
All right, morphine is a part of the opioid class of drugs, and opioids are a class of drugs derived from the opium poppy plant. And opioids have a variety of effects, with pain relief and a sense of euphoria being the most prevalent. And while opioids are prescribed for pain relief, they are often very controversial due to the tendency to lead to addiction. And as for the synthesis of morphine, morphine is typically obtained from either poppy capsules or opium, and these typically have a morphine content of 9 through 14%. The opium is extracted with water, and then when mixed with ethanol and ammonium hydroxide, the morphine will precipitate out of solution. This morphine is then further purified through crystallization. As for how morphine works by changing the way our brain and nervous system respond to pain. The drugs enter the central nervous system in the brain and find the opioid receptors that are located in the reward pathway and the pain pathway. Morphine is metabolized into morphine 6 glucuroniide, and M6G has a high affinity for the mu opioid receptor. Opioid receptors bind to the nociceptive pathway in the nervous system, inhibiting the signal of pain to give pain relief. Dopamine is released when morphine binds to the receptors in the reward pathway, which can cause a sense of euphoria. Repeated action of using morphine can cause drug dependence, which can further lead to abuse, addiction, and overdose.
So next we're going to talk about abuse of morphine. What is considered abuse of morphine is when you're using it without prescription. We consider that abuse. Morphine is often abused because of drug dependence and its pleasurable effects like euphoria. And once people get addicted to that common euphoric feeling, it will eventually lead to overdose. Morphine overdose signs include intense drowsiness and increased thirst, things like that. And below is an interesting stats of drug death in US. According to the stats, more than half of the accidental drug death in the States were caused by morphine and heroin. And then we're going to talk about morphine in relation to other drugs. So morphine is considered to be a CNS depressant. What those depressants do is they slow down the brain activity. Other than morphine, alcohol is also a major and common CNS depressant. Combining use of CNS depressant, in this case, using morphine with alcohol, can cause extreme sedation and respiratory failure, or more serious, even coma and death. And recovering from morphine addiction, there is actually a lot of programs that will help help people from recovering from morphine addiction. There's something called detoxification program that all the medical detox program and hospital and rehabs provide. And there's also another program called residential program. It's basically like rehabs. You live on the site of a facility to separate a person from outside triggers and allow 24 hours supervision. And normally the rehab program lasts like 30 to 90 days-ish. There's other treatment used with the residential program, like cognitive behavioral therapy, group therapy, and then also other type of therapies. There's also another treatment called medication-assisted treatment. It's the combined use of behavioral therapy and certain medication that can reduce the drug craving. And then that's the end of the presentation.
Thank you for joining us.